Conference, Digital Transformation of Healthcare, and welcome to the sessions, Patients and Healthcare Professionals, a partnership for and through digital health. So I'm very proud and privileged to be your moderator for this session. And we have also four wonderful speakers for this, three wonderful speakers for this session. And that's Daniel Dragman from the Ketonic Hyperglycemia International and a member of the European Health Parliament. As you will say some words about herself in the statement part. We have Annabel Seebom, Secretary General of the Standing Committee of European Doctors. And we have Chloe Labas, Vice President European Affairs of European Pharmaceutical Students Association. So we have quite a distinguished panel to discuss the topic of patients and professionals. And I think maybe as a context, I think we all agree on the potential of digital health. We're making healthcare more person-centered, more efficient, enabling also professionals in doing their work better, and better understanding research, etc. And also, the pandemic learned us that the uptake of digital was suddenly much better than it was before. However, despite all the sort of positive sort of remarks and cheering about digital health over the last 10, 15 years, we don't see very much the impact yet in many healthcare systems, countries, organizations, etc. So also what the pandemic has learned, it was not the disruptive strength of digital, but actually it were the circumstances of healthcare, the healthcare context, the pandemic, which make that people used already ready-made communications, which were available before. And so I think also for our understanding, and also from a professional and patient point of view, apparently digital is not in itself the transformation force. We have to probably do other things. So without further ado, so we have probably many things still to improve. And we know that in the context of the pandemic, in the context of lesser resources available, an increasing demand and complexity of care, we are not yet at the beginning of making real benefit of the potential. So therefore, it's also, okay, considering the patient, the primary users' point of view, professionals and patients, what can we do? So I think we have speakers here who are quite equipped to give you some views. The roadmap will be, we start with some statements from each of the three speakers, after which we start the panel discussion. After the panel discussion, we are very happy to take your questions. So please put your questions in the chat on the platform, and we will try to answer them and discuss them in our panel. So again, thank you very much, and I'm looking very much forward to this discussion. And I would like to invite Annabel as the first speaker to give her view on the topic of a partnership of patients and professionals for digital health. Thank you very much.
Thank you, Nick, for the kind introduction, and thank you very much to the European Patients Forum for inviting CPME to this very, very actual discussion. And just to briefly introduce myself, I'm Annabel Seebom. I'm the Secretary General of the Standing Committee of European Doctors. We represent national medical associations across Europe, from EU countries, UK, EFTA, as well as observer countries such as the West Balkans. So altogether, we represent 37 countries. We are the physician's voice towards the EU institutions. And that's and one of our topics we deal with heavily is, of course, digital health and the digital transformation in healthcare. And I have the pleasure now to introduce to you our work we have done together with the European Patients Forum, together with the Council of European Dentists, with the European Federation of Nurses, and the Pharmaceutical Group of the European Union, that is called the Consensus Framework and the Digital Transformation in Healthcare. I'll put the link in the chat and you can read our consensus framework. In this consensus framework, we were outlining 4 key recommendations that the digital transformation in healthcare in our sector cannot go without. And we had 3 starting points when developing this consensus framework. Starting point number 1 is our sector is special and it should always be driven by high quality patient care. Starting point 2, we realize an increased access to health and patient data, and that brings a lot of opportunities, but also more risks. For example, to understand where the data will be stored, who will have access, who can tamper it, and most importantly, what further uses will be given to it. And are those compatible with the initial use? Starting point number 3 for our consensus framework was following our professional obligations, that is confidentiality. The protection of patient data is a core pillar of our professions. Now, what I would like to do is to briefly explain to you those 4 key recommendations. It's not exhaustive, therefore I refer you again to our consensus framework, but just to give you an idea of what this is about. Key recommendation number 1 is uphold citizens' trust. So how do we do that? Well, quite self-evident, we have to guarantee a very high level of data protection and full compliance with professional ethics in digital health. And here, the GDPR and the future AI Act on artificial intelligence are essential legal instruments in this regard. Along with patients, include health professions' advice in the design and validation of digital health, that is co-creation by design. And also, we ask to develop clear standards and legally binding assessment criteria to ensure transparency of AI systems, coupled with clear liability mechanisms. And of course, guarantee for a good communication and collaboration between patients, health professions, and IT developers. Our second key recommendation is about sharing health data. We need to safeguard patient autonomy and confidentiality. Now, from the principle of patient autonomy follows the right to self-determination, and that is to make free decisions regarding him or herself. Patients have the right to give or withhold consent, and not just to physical procedures, but also to sharing data. So we have to inform patients as to who will have access to his or her health record. We need to ensure that health data is used in a manner which is scientifically sound and ethically acceptable. And of course, we need to ensure patients full control and visibility of their electronic health records. Third key recommendation is about patient safety and patients' rights need to be respected in the online provision of medicines. And I think maybe Chloe, you will elaborate on this a little more. One of the key requests is that the country where the patient is established should determine the level of protection offered. The provision of online medicines should be operated by professionals aiming to improve the quality of care and not by commercial motivations. And here is, for example, in our consensus framework, we gave the example, there's currently a case in Poland going on where there was some phishing of e-prescription data in social security systems, and thereby profiling patients with advertisement or something alike to buy certain products. That's certainly a commercial purpose, and that should not be the case in the online provision of medicines. And of course, we need to increase awareness on this topic and should use the EU logo identifying legitimate sellers of medicines. And finally, when it gets to telemedicine and telehealth services, similar requests we have as for the online provision of medicine, but in addition, we should also not allow commercial factors to influence telemedicine and telehealth services. The aim is to improve quality of care, and any conflict of interest should be declared. We need to have secure and stable platforms that protect patient and patient confidentiality. Online provision of medicines as well as teleconsultations should complement face-to-face consultation and not replace personal interactions and physical examination by health professionals. They should also reflect patients and health professionals' needs, keeping in mind accessibility for patients. And ultimately, we need to avoid a one-size-fits-all approach, as that might even worsen inequalities. I leave it here. I post the link to the consensus framework in the chat, and I'm looking forward to the discussion. Thank you.
Thank you very much, Annabelle. I think this is very important. And actually, I do think it's one of the first frameworks related to care provision in relation to digital health, where the sort of joint effort between patients and professionals as primary users in this context is delivered. But nicely, I think, also summarize some of the functional needs on how this should work, and the sort of, okay, what are the sort of conditions? And I think this is quite important in order also to provide information and requirements from suppliers, from industry, and also academics for tailoring their sort of solutions or ideas for digital health. So we elaborate further on in the panel discussion, obviously. So we now move to the next speaker, which is Daniel Drachman. And we are very interesting to hear your perspective as a patient representative, carer perspective, which, of course, it's also quite relevant, considering that patients are usually also have a sort of context with family, friends, informal carers, which is also part of the care system. So it's not only about the patient itself, but usually also the sort of social context. So please, the floor is yours.
Thank you so much, Nick, and thank you to the EPF for having me. I am so honored to be invited to speak with you all today and to be among such amazing people. So thank you so much. As you know, my name is Danielle, and I am the mother to Noah and Savannah, who is suspected to suffer from an unknown rare disease. When Savannah was diagnosed, it only took a few months before they found that it was potentially genetic, because they found that my symptoms wasn't actually ADHD, it was actually severe ketotic hypoglycemia, like my children suffers from. So I'm both a caregiver, but I'm also a rare disease patient. And that led me to establish a global reaching patient organization called Ketotic Hypoglycemia International. And in that organization, we are initiating patient-driven research using the citizen science methods to identify new research questions and needs to be answered. I am also a part of the European Health Parliament in the 6th round, where I'm in the committee for telemedicine and patient-centered care. And for those of you who have never heard about it, the European Health Parliament is a movement connecting and empowering the next generations of European health leaders to rethink health policy in the EU. I also sit as a patient representative at the EMA for non-diabetic hypoglycemia, and I work as a project coordinator in the Danish Committee for Health Education in the International Projects Unit. And now I want to present just a few of our recommendations from the European Health Parliament. We believe that telemedicine has the potential to advance, support, and facilitate patient-centered care. However, quality and infrastructure must improve, ensuring equity in the access to services. To reach this, we believe, just like Annabelle said, that trust and awareness gained by co-creation processes with the end users is part of the key. We also think that the creation of new digital tools and e-health solutions often happens in a very local and regional levels. Where could we be if we had a reimbursement system, quality labels that enable these great initiatives to expand to reach more citizens across Europe? We also think that we need to support the developers to co-create with the end users towards a need-based and e-health and telemedicine solutions. We need to acknowledge the fact that we have to invest in digital health literacy and foster the implementation of local health literacy and skills initiatives. This both for the citizens, but also for the healthcare professionals. We came up with the idea that we should consider making a quality label for telemedicine solutions to ensure transparency, trust, and alignment with citizens and healthcare professionals. We need a very strong focus on digital literacy for healthcare professionals, which could be done by linking the national hospital innovation networks with the European digital innovation hubs. We need to make sure that we are exposing the healthcare professionals to digital health solutions. We need hands-on learning experiences on the regional and national level networks, and it should be established and strengthened. We need skills, training, and testing before investing. And that could be done if we started to review the medical curricula of the future healthcare professionals to ensure that the professionals are actually equipped with the digital skills we have to provide this high quality care, where we can't deny that the digital part will forever be a part of our agenda and the way forward for patient-centered care. So thank you for having me.
Thank you very much, Danielle. I think that was really, really nice, and also pointing towards this the co-creation approach, which of course is for many years has been around, but actually in a sort of way that it can further strengthen implementation, upscaling, the sort of type of services which are tailored to the user needs. I think it's still a thing to further work on and to strengthen in this respect. So of course, also for these topics you mentioned, we go back also in the panel discussion. So and that leads to the third speaker, Chloe. So we're very happy to hear your views, also as a representative of the younger generation, so to say. So the floor is yours.
Thank you very much. Thank you very much for having us and giving us the time to also explain what the youth and mostly the healthcare students think of this matter, as they are really well engaged in the topic. First, I would like to introduce myself. I'm Chloe. I'm the Vice President of European Affairs of EPSA, the European Pharmaceutical Students Association. We represent over 100,000 students all over Europe, who come from 45 national and local student associations across 37 European countries. I can only agree with what has been said by the previous speakers, Danielle and Annabelle, and students are very well aware of the need for the upskilling of healthcare professionals. Some numbers I think are important to raise at the beginning of the discussion. Where first, the pharmaceutical curricula as well as the healthcare curricula is seriously lacking the implementation of e-health and digital skills. Indeed, 3/4 of students claim to have no or almost no education in e-health, and half say that they are barely becoming aware of the importance of digital health in their future practice through their curricula. Also, the Professional Qualification Directive is still lacking some crucial competences and knowledge and skills in the training of pharmacists. And from what recent surveys show, it really does show in the curricula, as only 17% of students report being taught digital literacy in their curricula. This does not mean that students aren't aware of the importance of digital skills, and mostly for a patient-centered care, but they do not learn it through their curricula. Indeed, students have really expressed the desire to obtain a broader overview of e-health and digital skills for many reasons. The first is the most evident one, which is the access to healthcare for people who are either unable to move, elderly, but also for patients living in rural areas. Also, healthcare literacy is really important, as it can increase collaboration on data sharing, and therefore personalized medicine can come from this. For example, with professional being able to follow the patient's responses to treatment, and also patients being able to self-care by helping them monitor their health conditions and treatment by themselves. How to improve this, and how can digital skills can become more included in the curricula? Well, first, it's important to say that students think adding them to the curricula is essential. Digital skills can also be taught through other platforms, as the European Union has also developed their own teaching platform for digital skills. But it is not enough. As healthcare students, it's not only about digital skills and using digital tools. It's also about understanding and maintaining humanity and care through those digital tools. Pharmacists, especially, as pharmacists are healthcare professionals of proximity, it's important for students to learn how to communicate with students and to apprehend how they communicate through those platforms. And this is something that cannot be taught only through digital skills as using softwares and all. Students are willing to take classes related to e-health, going from mobile application to robotic equipments. And they mentioned the need for a theoric and practical courses all at once. They also want multidisciplinary courses on digital health, as it can also help with real life simulation through their curriculum. Thank you very much.
Thank you very much. Also, very relevant point, and obviously also related to the other previous topics discussed. And an important thing: how do we train and prepare young professionals for the sort of decades to come, where probably our societies and the type of care is quite different, I think, from the last decades. Also through the use of all opportunities we have with smart tools, the availability of data at hand, real time, etc. So we now starting our panel discussion. And I think, considering the topics discussed on the sort of professionals through the frameworks and the sort of requirements, functionalities, the patient perspective, and what nicely Daniela touched upon, a sort of tailoring of services and technology towards the patient needs, user requirements, and also this perspective on, okay, how do we prepare both professionals but also patients in making better use of these opportunities and functionalities. So it's a bit of discussion, I think, also in this perspective of the European landscape, that we should view it from a very specific local sort of perspective on, okay, what is a professional or a patient can do as an individual, but also a sort of higher system European level, where healthcare system countries maybe should do in order to accelerate the potential of digital health. So in the sort of order to start with Annabelle, as well, we had the statements. Annabelle, so for the professionals, they have a sort of traditional structure with professional groups in which they secure sort of knowledge development, quality, safety. So there are sort of existing ways how to improve and change new knowledge and care services, etc. So how would you foresee the sort of rollout or the sort of way how to work with elements from the framework? How could this work if you see this in a sort of European perspective? What should we do as professionals?
Well, one thing clearly all of us touched upon already is the point on digital competences. And that's what we currently work on a lot on the profession side. What we are advocating for is to have a multi-professional core curriculum, basically, for students, but also then for specialist medical training. So it's not just about the young professionals or professionals to be. It is also for the ones already in training or even after training. So we need to cover every step in the career. And that's why we think it's not about creating a new medical specialty, something like called digital specialist in digital health. That's not what it's all about. What we need is to adapt to a specific specialty the needed competencies. And we think for any current and future doctor, there are three basic things. We need to have general digital skills. That's about knowledge about data protection, ICT safety, problem solving, etc. We need to have technical digital skills, such as how to work with telemedicine, health apps, AI, data literacy, robotics. And thirdly, we need to have communication skills in the patient-doctor relationship. How does digital communication actually work? How do you collaborate digitally? How do you promote digital health literacy towards patients? So there's a lot to be done, and it cannot be done alone. It's a multi-professional thing in a way that we also need to draw knowledge from the IT developers and other professions. So what we have in mind is to start at student level with the curricula, but also to look at what is the core curriculum for specialty training adapted to specialties. And then when you're done with your specialty training, also to implement it into continuous professional development to make sure that the current doctors working get to speed.
Mm-hmm. Thank you very much. I think this sort of what you see is the different sort of ingredients for building new skills, better skills, and competence in this digital health. For professionals, I think it's already there. There's a lot of, I think, also research done in this perspective. I think the framework is very clear and nice. So the rollout, the implementation is probably also probably a challenge, considering if I look to the Netherlands, if we want to make changes in the medical curricula for medical doctors, well, on estimation, it takes about 10 years to change some elements. And I'm talking usually about introduction of a new area in medicine. So this takes really long, usually in this, because all the sort of interest of existing professors who all think that their own topic is the most important topic to discuss, and it should require a lot of hours and studying to do this. So just to give you a sort of explanation how sometimes it can be really difficult. So this makes me to ask a question to Chloe, because you're currently in the sort of situation with other students, and you see the sort of requirements. So what is your experience and also view on how can we accelerate this process of curricula change?
Yes, thank you very much. Well, it is true that we have noticed that the change to the core of curricula is a long-term process, and that will not be changed in the immediate term. Some solutions that I have witnessed in, for example, my university in France, it's the implementation of extracurricular work, but who also can help obtain an adding value to your curricula and something that is recognized by the university, but also the educational ministry in France. So there are ways to implement it in the curricula without changing the actual curricula. And this is something that needs to be the universities, but also the governments, the national government's initiatives, which is also something that is maybe more difficult in order to have a harmonized level of skills all over Europe. But this is something that can be done. Also, we have noticed that many students are taking the initiatives by themselves and trying to learn digital skills through mobile applications, for example. We know it's not the same, and we are aware that, as Annabelle has just said before, that there is the need for professionals, but also for digital technicians to explain to students and future healthcare professionals how to use those tools, and also how to understand communication, how to communicate with patients through those tools. But if it helps universities to have a first part done by the students through maybe some lighter or more long-term training through applications, for example, on mobile or through platforms, this is something that can be done. So more time can be spent with the universities and with the professionals on some more concrete knowledge for healthcare professionals, as said, for example, communication or data sharing.
Thank you very much. And so also this shows it's probably a longer process, which takes also effort to make it real in the formal medical curricula. But I think also what you said, Chloe, and also Annabelle, it might we have to reach out to those already in practice through postgraduate courses, training, etc. So probably we need a sort of parallel sort of approach by which we can reach out to all professionals, whether it's a student in training and existing curricula, and change gradually the sort of curricula with better implementation element of digital health, as well as more the practice approach. So accordingly, probably also it has implication on how we have the sort of strategy in order to put this forward. I think it also touches upon the role of patients and carers, because the sort of involvement in also training and learning with each other is, I think it would make sense to do this in a sort of joint effort. And I would like to ask Danielle, so how would you see, in the perspective of training and learning and competences, what patient potentially could bring to professionals and students in this respect?
Thank you for asking me that question. I think it touched upon a totally general issue amongst the dynamic between a patient and a healthcare professional. And now we also have a third stakeholders, being the developers. So when we are talking about the curriculum, we could maybe think about a more general term about how do we co-create together? How does a patient and a healthcare professional and a developer suddenly unite in an innovation team towards an innovation or an e-health solution, a telemedicine solution that actually works for the end users? So if we are to think about how do we gain the digital or heighten the digital literacy, I really think it touches upon how do we work together, how do we learn from each other, and how do we can talk about we need more digital skills, but we can also talk about what about using the skills that is already present? How do we develop solutions that works for those with the lowest skills? And I also have a conflicted relationship with the word literacy, because, well, what is literacy, and who defined who has a high literacy? Can we instead look at it the other way around, look at the resources from the healthcare professionals, the developers and the patients, use these resources to tailor what we are going to make to get this happen? Yeah. Yes,
very, very important. And I have a follow-up question for you. Yes. Because also in this co-creation, it implies, okay, you should involve patients, carers, but also from a sort of needs perspective, the complexity often of needs, like you're telling yourself with children, sometimes you have aspects related to education and the school involved, or maybe other social children want to participate in sport or other activities, which are linked often to, let's say, the problems or needs people have. And so this touch upon multidisciplinarity. And so I'm thinking about how you talked about local and regional, which So what is your view on how this could work when you have local settings, persons like yourself or other people with the sort of variety, complexity of needs, and how professionals could maybe learn from that in order to improve their services, including digital?
Thank you for that question. I think it's funny you said that the co-creation, and then it's about involving the patients and the end users. What if we instead started to talk about doctors' involvement, healthcare professionals' involvement in the citizens' projects? If we started using the movement of empowering citizens to engage, to innovate, then I think I think the term patient involvement or doctors' involvement, the whole involvement part, that's outdated. We need to see each other as stakeholders. If you live and you have absolutely no educational background, you might still be the person who identifies a need for innovation. That doesn't matter if you don't have the digital skills. You simply just need to be empowered to take that idea and move forward, uniting those skills that you don't have yourself around the table. That's sometimes healthcare professionals, that's sometimes e-health developers. But I think the whole core about this is, how do we talk about each other? Are we talking about someone being involved in professionals' project? Or are we actually talking about actually co-creating and not involving people, but we are co-creating as equal multi-stakeholder, a research facility, an innovation facility, where we are equal. We are not involved in each other's. No, we are equal. Because then I think we should really start to talk about doctors' involvement in patient-driven research. And I think that's just, for a doctor, I think that's condescending. Well, that's actually also condescending if we talk about patient involvement. Yes.
I think that this is really interesting, because it's more, we often talking in this type of conferences and etc. on these specific issues, and we do research and etc. But is it actually more just that we have to look at just daily practice and how, for example, primary care with paramedics, with GPs, etc., already are being sort of natural relations in how we talk about, okay, how can we solve your problem, or how together we can solve problems. So coming back to Annabelle, and so if you look into the sort of professionals we have on the ground and looking at their settings and how we could support them to translate the sort of knowledge, ideas, frameworks, and experience we have with. So how could this work from your perspective?
Yes, first of all, you need to have, I think, organizational encouragement in the healthcare setting. You need to have the necessary funding. So it's not like, oh, we have a wonderful new tool, see how you can buy it. These are, let's say, practical problems. But we think what is really needed to get the application of digital into the local level is that we need so-called digital champions. We need people who drive and are mentors to their peers how to make best use of digital tools. We think these people can be found at local, at regional, at national level. They need to be identified and encouraged to lead their peers in how to apply these tools. What we currently do at CPME is we've developed a leadership course on digital skills. And we run the first pilot in December to do exactly that, to train people who might have the potential to be so-called digital leaders, to enable them to be a role model at national, local, regional level. But I think these types of role models are needed.
Yes, and a follow-up question. So do we have the sort of examples and sort of clinical guidelines ready to support them in terms of that we can talk to colleagues? Okay, here are some elements which are more related to the practice, if what you can do with how it could work with patients and carers, with your colleagues in primary care, hospital care?
So your question is whether all the guidance is already set and done?
Yeah, do we have the tools and guidelines, for example, available to explain to our colleagues, nurses, doctors, physiotherapists, etc.?
Again, as I said, that depends a bit on the field you're in. I mean, probably it depends on the specialty, and I'm pretty sure that in some specialties this is already in place, and others it's less. As I said, it's currently growing, and that's something we need to work in parallel on to get the training fit for purpose and to have all these guidelines in place. Mm-hmm. I don't have a sophisticated overview about the situation at local level, I'm afraid. I'm sorry, Nick.
Yeah, but do you think we should have further promote this, endorse this on those more practice guidelines in this respect?
Surely.
Mm-hmm. Okay. Chloe, you also talked about the necessity of students being taken part in this process. So how would you see this if more at a regional, local level, and what students might contribute to this sort of process of change?
Yes, thank you. Well, I have to say, I really like the idea of having regional leaders at all levels that Annabelle talked about. I think students, before being students, they're youth, and as youth, they are, for most of them, they are born in the digital age. So they have a certain approach to digital, and they have been raised in the digital, and they can maybe bring something to the discussion, as they are the future users of the digital. They're also the first ones concerned, as for now they're not yet professionals and have been using it as non-professionals. So I think it's important to keep that in mind, keep the fact that students are youth. They have a naive eye on the matter as well, which is I think in between professionals and patients, and also the fact that they know the tools for some of them, and they also need to let them know what their needs are, since the needs of the students in terms of training, I think, is different from the needs of healthcare professionals because of that gap and the constant evolution of technology.
Yes, thank you very much. And also for you, a follow-up question. So what do you need actually in making your ideas? And I think your ideas and views makes very much sense and very important for students, younger generations, professionals. So what do you need from your perspective in order to make a real fast change in this respect? How could it work? How can we make an impact?
Well, I think the key word since the beginning has been empowerment, and I think it's also the case for students. I think, as Daniel said, students need to be involved as one of the primary stakeholder in the matter, as equal as patients and healthcare professionals. So I think this is the most important thing, to be consulted. And then also something that was brought on by Annabelle, I think the most difficult thing about training, but also digital in general, is the funding behind it. Because training for digital skills means also giving access to digital skills for students to train and to discover the tools by themselves. And I think that's something that is lacking to universities, but also to any stakeholders willing to train students and help them involve in that area.
Mm-hmm. And more politically, so do you think the voice of students is really taken serious in Europe, in countries and medical? If I'm looking to my daughter, she's a medical student in her internship, internal medicine currently. But if she's so busy and so she's really occupied with all kind of things. If I look, although the Dutch system is considered to be quite democratic and sort of participation of students, but as said, in reality, the change is really not so big, according to the patient voice, except maybe some exam results and complaints. So how we really would be that patient, for example, could be a partner in this effort of students. We demand more, better practice-oriented curricula with involvement of patients and carers and also digital. Is this something we should do, or is it already sufficient enough?
Well, of course, I think it's not sufficient enough. But as I'm from France, and I come from my national association, where we have just built a position for a digital officer representing pharmaceutical students. And I think we have had a really close contact with everyone in the government working on digital skills for health. And we have been consulted a lot. I do think the relationship between students and patients are lacking, but mostly because I think it's not something that is natural, unfortunately, for students and patients to collaborate. Usually it always goes through healthcare professionals. So I think definite collaborations and discussions between patients and healthcare students will help on digital skills, but also on a broader level, since students, if they are sensitized by the patient's needs on such an early level, it will also impact their way of using all the tools and practicing as healthcare professionals. So there is definitely work to be done. I think the first thing is to reach out to the relevant stakeholders and express our knowledge and our needs, and we can move forward from there.
Okay, very good. I think it's maybe also good to have a look a little bit on the questions, which are many in the chat. A bit related topic maybe in the use of patient-reported outcome measures and patient-reported experience measures, which is reflecting some of the elements of the relation between needs and how care is provided. So, Danielle, in this sort of better understanding about patient needs and what professionals can do in offering services, including the sort of digital, this whole development with measures, indicators, is it helpful? What place does it have? Is it really helping in this sort of understanding you have to need at a sort of local level in care provision? How does that work?
Well, I definitely think that those measures has been a very important step towards where we hopefully will be in the future, acknowledging the patient and the caregivers as stakeholders. I think they have been important and laid the foundation for us now stepping up to the game as stakeholders. And I see a movement of caregivers and patients suddenly finding the gut and the trust in the system that, yes, we are an important stakeholder in this matter. And it doesn't make sense to move forward without making sure that what you are moving forward with is actually relevant to those you are doing it for. So I definitely think that these measures has been a very important brick and a stepping stone to where we are today. But I also think that we can do much, much, much better now, thanks to those who laid that foundation. Yes.
Mm-hmm. Coming back to Annabelle, so from a professional point of view, so over the last years, we saw developments in better access to information, whether it comes to understanding about disease processes, as well as communication with patients. So do you foresee a sort of next step in what professionals need from digital in order to work better, more efficiently, better team approach? Are we there yet, or do we have to seriously add some other things in this process of digital health services?
I think any digital solution should be embedded in the actual workflow. So it must not remain in a theoretical sphere as a bureaucratic layer people feel somewhat hampered by, but rather it must be embedded in the actual workflow to what is really needed in the care pathway. It must be in it. It must reflect the patient's needs and empower them to better manage their health. So, yeah, it should be naturally part of the care flow.
Yeah. So in this respect, so because the solution providers in this is industry, so do we require a different sort of approach or attitude from industry in how they look to the sort of collaboration and etc.?
Yeah, we discussed this when it gets to IT developers. I mean, they have a huge knowledge in what they're doing. It's a bit of a closed shop for all of us because we simply don't know. We are not trained in understanding how IT works. That's why we say, since they're that important for the development and since their influence is extremely high, there should be some oversight about IT professionals, preferably in an organized structure where they abide to their own codes of conduct and have to adhere to them, and if not, they are sanctioned, because what's at stake is too important to sort of leave it uncontrolled, no matter what. Simply, it's a good solution and this is it. No, this is what's not about. They need to be accountable as well in what they're doing, like health professions are as well.
Mm-hmm. Yes. So I'm looking in the chat, and there are some various questions. So one of them is digital change leaders, and obviously we have already some people quite active in this area. So when it comes to change leaders in sort of students, Chloe, could you reflect a little bit on how this might work with students and young professionals? Do you think they are well represented? And if not, what should we do? How does it work with a sort of leadership or role model in this respect? Chloe? Did you hear me?
I apologize. I thought you were addressing the question to Annabelle. Yes, I definitely agree that digital change leaders is something that is essential. That is also something that we can see happening at a national level, also in France, but in other countries. We can see that there is a national officer and other students that go in different regions in France in order to raise awareness on this topic to universities, but also to students as part of the helping training team, if I can say so. So yes, it's something that's really important that also needs the help of governments as well as healthcare professionals, since students need the training in order to become change leaders. As Daniel has also said, we need to know what we're doing it or what we're doing it for and to who, to understand the end of it. So I think that these are the needed aspects of it.
I see Danielle is waving her hand for responding.
Yes. So when we are talking about these digital leaders, I really think we should also consider how we can empower the developers to be digital leaders, to raise up to the challenge of, yes, we need to co-create. We need to empower them also to meet what we see as the gold standard for a telemedicine solution. And we at the European Health Parliament believe that this can be done if we are working with these industry stakeholders, the developers, and plan how the patient and the healthcare professionals' co-creation processes are incorporated in each stage of the development of the telemedicine solutions. So it's how do we talk about it? Are we talking about that they need to be accountable, or are we talking about it as we need to support each other because they are also entering into a world that they might not understand, many of them, but we are here, experts by experience, to support each other. We can't do the technical part, but we can definitely bring in the perspectives of the experience, the need, the end users. Yeah, sorry.
No, I think a very good point, and because also referring to this partnership, whether it comes to make better use of knowledge from each other as sort of from an experience perspective and also in the development. The key is how we organize ourselves, interact each other, whether it's on a local level or more at sort of higher system level or network level like Europe or a country. I saw Annabelle raising her hand.
Yeah, just to add, that's why we really support this idea of a multi-professional core curriculum, meaning bringing together everybody involved, engineers, scientists, IT people, legal people, to really put the knowledge together and to have a core curriculum from which you can learn and then build on it for what is needed then in your future career as a professional, for example.
I think that's very nice and very points towards, again, so if we could capitalize on those local regional ecosystems where patient needs come together with a professional, the social structure, the social context, and you can make this sort of learning environment, an environment for development and for delivering solutions in terms of care and technology, etc. I think that's the way to go. And I think mentioned by many of you. And so the point is, and we're coming almost to an end, so I try to summarize a little bit about what we have discussed, the very important issue we discuss. It comes also that I think all what you explained about what's needed, how things should come together, whether from a technology perspective, from education or literacy perspective, it all comes down to how we make it work at both at the local regional level, but also on a higher level, that we can benefit from all the different developments in different settings and regions. And also by that, strengthening the voice of patients and professionals in a positive change. And I think also what EPF is doing in this respect is a very strong platform, because it represents the patient, but also the professionals, because we can't separate them if you talk about sustainability of health. So the questions, some of the questions raised. So we go after the session is closed. We also look into the session and how we can answer your questions, whether it's related to GDPR, etc. So keep in touch, and we will reach out with some of the comments. So we have 1.5 minutes or even less. So maybe some short concluding remarks on three of you. So in 50 seconds, maybe. Danielle, please.
Yes. So I think that my most important point here is that I believe that we are moving towards a paradigm shift about how we think about collaboration, innovation, the role of a patient, the role of a developer, and the role of a healthcare professional. Who has the patent on the good research idea? Who has the patent on an innovation? Now we see that patients are stepping up. We are also seeing the healthcare professional embracing this expert by experience stakeholder. So now we simply need to figure out how to develop the framework where this can be reimbursed and these innovations can reach those end users who need it the most. Thank you.
Thank you very much. That was really nice. We have really short time. We have 20 seconds left. So I think this was a quite nice summary. I want to thank you for your wonderful contribution. So please keep in touch and we keep this discussion going. And thank you very much for listening and participating, your listeners. So till next time, thank you very much. Bye-bye.
Bye-bye.